Infectious. How can I help you?
Yeah, I just have a prescription here for my daughter I'd like to get filled.
Okay, for sure. Do you mind if I spend just a couple of minutes kind of going through with you some of like what the prescription's for and kind of going through that?
Yeah, for sure.
And before I get started though, is there anything else you need help with today? Any other questions or concerns?
Not really, I just want to make sure that we've got the right dose and everything, so everything's good for Kelsey there.
Okay, sounds good. Can you just confirm Kelsey's birthday for me?
September 12th, 2010.
Okay, so she's about like 3 or so?
Yeah, 3 years old.
Okay. And so with that, what did the doctor say the amoxicillin was for, that this antibiotic that for Kelsey?
Well, her ear's been bugging her quite a bit recently. We went into the doctor 3 days ago. He told us just to wait a little bit, see if it resolves on its own.
Yeah.
But things aren't really getting any better, so.
What kind of symptoms is she experiencing?
Her ear's pretty red. She's been tugging on it, crying a lot.
Okay.
Yeah. She's also had a bit of fever.
What temperature is the fever?
I'm not really sure what the temperature is. I can't remember exactly. The thermometer just read that it was too high.
Okay. Is she getting any other symptoms in addition to the red, like painful ear, like a fever at all?
Well, yeah, her ear's a lot of pain. I'm thinking she's crying a lot. Like I said before, she does have a fever. A little bit of runny nose and a little bit of coughing as well.
Okay. Any nausea, vomiting?
No, nothing like that.
And have you tried anything so far to treat it?
We just tried a little bit of Tylenol.
Okay.
It's been helping out a bit, but not quite enough for my liking, We've got to get her back to daycare, so.
Yeah. Okay. So helping with like both the fever and the pain, you would say, or?
Yeah, a little bit for the fever. The temperature's gone down a bit. I guess she's a little less irritable on Tylenol, but still she's not sleeping well.
Okay. Okay, so I guess these antibiotics will for sure hopefully help with that.
Yeah.
So just going back to a little bit of the onset, you said 3 days ago it started, or you went to see the doctor 3 days ago?
Yeah, it's kind of started 3 days ago. The first day we went to go and see the doctor after it started. So.
Okay. And has this ever happened before for Kelsey?
Well, she did have some trouble, especially when she was under 2. She had quite frequent ear infections, but recently I would say like 5 months ago was the last time she's had it.
Okay. And I guess back then, do you recall what you did? Did you also get antibiotics at that time?
Yeah, I think it might have been the same thing. I'm not sure though.
Because we do have record on file that last February she had a similar kind of idea.
Yeah.
Okay, so that's good. Did you find anything that makes it worse for her?
Not really anything that makes it worse. Just trying to find something to make it better, right?
Yeah, because the Tylenol wasn't quite helping to your liking.
Not really.
Okay. So with that in mind, so that's for sure the antibiotic can for sure help. I just want to do a quick medical history just to make sure that this medication is appropriate for any other medications Kelsey's on.
Okay.
So I guess to get started, is there anything else Kelsey has?
What do you
Like, sorry, medical conditions.
Okay, no, she doesn't have anything.
Okay. How about any allergies?
No allergies to anything.
And as well, in terms of, I guess, social history, sometimes smoking in the environment can worsen the ear infection. Is that a problem at home or in daycare at all?
No.
Okay. And is she taking any other medications other than the Tylenol you mentioned?
No, not right now.
Nothing else?
Hopefully that's.
Okay, so just this then. Okay, and just to double check, so the doctor has prescribed her again a suspension. Did you find like the taste of it okay last time of like the same antibiotic?
You know what? I had trouble giving it to her.
Okay.
I'm not sure if it was really the flavor or what it was. She just, she sees medicine. She's not really too happy.
Okay. Okay then.
Is there any way to make that better?
I guess how did you administer it to her last time? Just the syringe?
Yeah, I gave her from a syringe just in the mouth, but she kind of had to hold her down type thing. It was tough.
Okay. So I guess with that, maybe potentially you can maybe mix it in with some applesauce or pudding, perhaps.
Yeah, she likes those kind of things.
Okay.
You could try that.
You could try that. That would be good. Okay. Okay. So with that in mind, I guess we can move on to the drug. I guess you've had it before, so I'll just kind of briefly go over it again. It's called amoxicillin, and you're to give 200 milligrams about 3 times a day, so probably with the meals or so. And I guess like what you said, you can probably mix it in with some applesauce or some pudding for her. And she should see benefits within 2 to 3 days, kind of thing. And if she doesn't, if she's still the ear pain or anything like that, do go see the doctor again, because it might be a little bit harder to treat case.
Okay.
And as well, there are potentially some complications with ear infections, such as meningitis or kind of like infection of the bone behind the ear. So if you notice that Kelsey is more drowsy than usual or very inflamed on the bone behind her ear, do take her to the doctor as soon as possible. And I guess just to verify as well, when you went to see the doctor, did they say anything about a broken eardrum or like a perforated eardrum?
No, he said it looked alright, just not exactly what you want, but
Okay.
he didn't really seem to be too concerned.
Okay, sounds. And then you said the last infection she had was like about a year ago, back in February, kind of thing.
Yeah, it was quite a while ago.
And no other recent antibiotics?
Oh, no other recent antibiotics.
Okay, so in terms of that then, just going kind of how to administer the medication, I think 10 days may be a little bit too long, because you were saying that she is older than 2 and then she hasn't had anything recently and the eardrum seems like it's okay. So would it be okay with you if I change it to 5 days? It would still do the trick, it'll still treat the infection, and it may be even better in terms of minimizing side effects if I go with the 5 days.
Yeah, as long as you feel that's appropriate.
Yeah, okay. And also just checking the dose. How much does Kelsey weigh?
Kelsey weighs 33 pounds.
33 pounds. Okay, let's quickly check the dose. Okay, I'm gonna also increase the dose for her to I guess 450 milligrams 3 times a day. But since she is in daycare, sometimes you get harder to treat bugs when you're in there.
Okay.
So I'll change it to just a little bit higher dose, and then for 5 days, if that's okay. Okay. So I guess taking it again, same thing with the suspension. Shake it before you give it to her, and do refrigerate it. So about 3 times a day or so. Do you think that would be okay? Like, can she get the medication during her like lunch or so in daycare?
Yeah, they won't let her back into daycare until
okay.
we've got it cleared up anyway, so it's not going to be a problem.
Okay, that sounds good that you can do that. Okay, so in terms of side effects, did you notice anything in the past with amoxicillin that Kelsey had?
No, just the trouble eating it, but
Okay.
yeah, I think for the most part she tolerated it pretty well.
Okay, sounds good then. I guess other things, just little things to watch out for, just in case she's had it before, kind of thing. But any like nausea or diarrhea,
Okay.
like if you notice that anything comes very disruptive or severe diarrhea, do take her to see the doctor. But otherwise, it's pretty well tolerated, I guess, and you already had experience with it.
Yeah.
In terms of at this point, what other questions or concerns do you have?
I don't think anything really.
Okay. And I guess, as always with infections, just like prevention, so hand washing and just washing shared toys kind of thing. That's otherwise, hopefully this will do the trick. So I guess, again, if it's not better, if she's still feeling worse after 3 days, feel free to call us to go see the doctor. And at that point, any other questions or concerns, you can call us as well. Okay, so I'll get that ready for you, and then I'll call you when it's ready. I'm June again if you need anything. Yeah.
Okay, thanks for your time.
Yeah, you're welcome.